Hi, I'm Doctor Mayank. I'm a board certified plastic surgeon and a diplomat of American Board of Hair Restoration Surgery, founder, Crown. Today I'm going to talk about what exactly are the stages of balding and which of this stage you may be at, according to which we would be in a position to plan what needs to be done for you. So let's go with one by one. Basically, the baldness is considered in form of a grade, which is in a Norwood-Hamilton classification for males, where based upon the kind of recession of the hairline that you have, accordingly, the grades are subjected. Now, what we need to be very sure about is what patients want is that we are given a perspective that we are having a grade this of baldness. This is our photograph, and let's just enumerate the number of grafts that we want and what are the kind of finances. This is something which is very common in today's date, but please don't fall prey to any of these. If any of these grades are where you are at, we are going to talk in detail today what exactly is the kind of management that we need to consider and what would be the overall journey after getting this kind of a procedure done for you as well. So please watch this video right till the end. In terms of this kind of a baldness, if you're having, this is known as a Norwood grade 2. I have clubbed Norwood grade 2 and 3 in this video, where the recession of the hairline is something which starts. The frontotemporal recession starts happening, and sometimes mild amount of temporal thinning also happens along with this. This could happen at any stage, any age. But what you need to be very sure about is that if this is the beginning of your hairline recession which is happening and is happening at a very young age, it is imperative for you to come and visit us or any qualified experienced plastic surgeon or dermatologist who needs to put you on medications to prevent further progression of losses. Don't directly jump in for a hair transplant at this stage or grade of balding unless it is affecting you professionally or personally extensively. Those pros and cons would be discussed with you by a surgeon. If we look at this case, he is a Norwood grade 2. Someone who's at close to 48 years of age with a minimal recession of the hairline happening along with some temporal thinning which comes along with it. What we need to be very sure about is that this hairline recreation, what is being done, is age appropriate. This should not be something which is created for you as a hairline of a 20-year-old if you are looking for this kind of a hairline looking normal at 48 years of age. The placement of the hairline, how it is designed, has to be an artistic view of what we want to achieve. It cannot be something which is a flat hairline with aggressive temples which makes you look like someone who's at 25 years of age. Obviously, it's going to look very unnatural. If you look at his side view, you can see how we have created the temporal triangle with the finesse. It is very fine, thin, single follicles taken specifically from the donor area to create this kind of a temple. It is not something which is aggressively created or made to look with multiple follicles in the hairline or the temples as well. So these are just very critical, important points which we need to follow. When this is created, obviously you cannot even perceive that he's undergone a hair transplant, and the kind of thinning which was affecting him is completely taken care of. Now, this is the other side of the temporal triangle also. We have just subtly created the same thing to fall in place, not making it look like an aggressive thing. This is something based upon your expectation as well. But when you talk in detail to the surgeon about what exactly is the thing that is bothering you, we can always customize the things as per an individual's need. But it is my responsibility as your surgeon to tell you what is going to make you look natural and what is going to make you look unnatural. This is another patient who's at a very young age. This is only at 23 years of age with mild recession of the frontotemporal junction and the hairline recession in the center on both the sides. This is not an age where I would personally advise a patient to undergo hair transplant. We had been following the patient up since 19 years of age, and after 4 years of medications which were given to the patient over a period of time, The patient actually decided that yes, I want to go in for a hair transplant because I'm not feeling comfortable with the appearance of my hairline and I have to actually cover it up and camouflage it, which is making me look abnormal in front of my peer group. So ultimately we went with a very conservative hair transplant, which is just a subtle hairline recreation along with the frontotemporal areas to be covered. So both the sides were covered and the hairline was there. This is something which we have taken care of basically using only 1500 to 2000 follicles. This is not something where we have extensively used a lot of hair or grafts. 2000 follicles amounts to close to around 1000 to 1200 odd grafts. So something which is conservatively extracted and implanted has been done for him, and he is disciplined with medications along with it. And what you are seeing is just at 4 months of the transplant. So this gets denser over a period of time as well. And if you look at the top view, it is entirely changed just because of that addition onto the frontotemporal junction and the density that we have added onto the forelock and the hairline. So going for a hair transplant at young ages, the candidature is entirely different. It is not something which we can actually do making him look exactly like his peer group. What we need to be very sure about is that this hairline that has been created is something which is going to stay for all the years to come. What you need to be very sure about is that the usage of medications is something that we have to be okay with. If you're not okay with using medications or you're not going to be disciplined after doing this, then this could be a disaster, because something which has been created in the front and then the rear part is not being taken care of is landing up in major problems. So be very sure, if you are young, if you are below 24, 25 years of age, or even in 25 to 30 years of age, the usage of medications is imperative. And following this also, you need to be very sure that your plan for the future is very clear and transparent in front of you. This is not something as a single stage of hair transplant that has taken care of his life. Over a period of time, when he'll have recession or thinning behind this hairline that has been created, he will require more hair transplant, which was transparently discussed, and pros and cons were talked about doing a hair transplant at this age. So I hope that you are clear that if you are at any of these stages, like a grade 2 or grade 3, you should not be someone who should go in for an aggressive hair transplant, irrespective of where you are, at what age you are, and your usage of medications is something which is extremely important. Let's just have a look at some of the cases which are also Norwood grade 3. So again, you can see the frontotemporal recession and the forelock thinning what he's having, and the kind of hairline that we have created is extremely conservative. It is not a flat looking aggressive hairline, not something where I have made aggressive temples for him. So this is something which we need to be very clear about. Be conservative, use the minimum number of follicles what you actually would require, because your donor area is finite. That is something that we are going to use over a period of time where you may require multiple sessions. Medicines is not something which is going to make your hair loss completely paused or stop. It is just going to slow down your progression. So this is something which we should be very clear about. Another case where a frontotemporal recession and forelock thinning, again a grade 3, where we have just created a subtle hairline with coverage of the forelock and frontotemporal junctions. So similar cases, if any of these grades kind of resonates with what you are suffering, I would personally advocate, please get in touch with us and let us just create some magic for you, which is in turn definitely going to be something which you will never repent, and you would be in a position to identify yourself with someone without a problem of recession of hair, and also something which we will not make unnatural in terms of the appearance that you get to see. I hope you liked this video, and if you have any further questions, concerns, please get in touch with us on the numbers given below. Do subscribe to our channel, and I look forward to hearing from you. Thank you.